Isolation for those who have the virus and a 14-day quarantine for close contacts are extremely important strategies that end the chain of virus transmission. And so limiting the spread of COVID-19 needs to be my family's focus right now, just as it needs to be our broader community's focus right now. Our community remains in the red area of the COVID-19 risk dial for a second week, as the number of new cases, the positivity rate, and the number of hospitalizations set record highs. Red represents the highest level of risk on the dial. It indicates that the risk of the virus spreading in our community is severe. Being in the red means that it's critical that all of us in Lincoln and Lancaster County avoid activities outside the home unless traveling for work, school, food, medical care, or to check on others who may need assistance. Please be diligent in following the 3 W's. Wear a mask, watch your distance, and wash your hands frequently. Also, please be committed by avoiding the 3 C's: crowded places, confined spaces, and close contact with others. Health Director Pat Lopez will provide more information about the level of risk we face and the indicators that we monitor locally in just a moment. Before she speaks, though, we want you to hear from several community members who are on the front lines of our fight against COVID-19. They're here to share the reality of what is happening in our community. Later in the briefing, we will also hear from school administrators and a business owner. We begin with 2 of the healthcare professionals who are providing direct care to those who are ill with COVID-19. As a pulmonologist, Dr. Jeffrey Jarrett specializes in the respiratory system. Taylor Straube is a nurse at the intensive care unit at Bryan. These are just 2 of the healthcare heroes who witnessed firsthand the impact this virus is having on so many Nebraska families. Thank you both for your selfless service during the pandemic, and thank you for joining us today. Dr. Jarrett is joining us by Zoom. He will begin, and then we will hear from Ms. Straube. Dr. Jarrett, over to you.
Unfortunately, Dr. Jarrett is running a little bit late, so we will start with me. I'm Taylor Straube. I am an ICU nurse at Bryan East in the COVID unit.
So kind of what we've been experiencing, our unit has been a COVID unit since the beginning, back in March. We, being in the ICU, have seen the sickest in Lincoln, and it's definitely been hard. We've seen people stay for months that most diseases stay for 1 to 2 weeks and then leave. It's been hard for our staff to watch families not be able to see the patients. We Zoom with them, we send them pictures, but a lot of times the sicker they get and the more they progress, it's harder and harder to keep those ties. And, it's heart-wrenching for our nurses, it's heart-wrenching for our doctors. And, we just hope that we can contain it somehow, because what we're seeing is stuff that we've never seen before, and it's a lot to deal with. For us, it's hard. For families, it's hard. And, if there's anything that we can do to see less patients come through our doors, unfortunately, a lot of the patients don't walk out of those doors sometimes that we see. So just think about your families. If your family was in that bed, unable to talk with a breathing tube, those are the ones that are hard because they don't get to say their goodbyes. So that's all I have. Hopefully Dr. Jarrett's here.
Thank you so much for the care you provide, Ms. Straube. Do we have Dr. Jarrett with us by Zoom now?
Not quite. He was looking for a place to set up, Mayor. So let's just move forward and we'll get to him when he comes back.
Okay. Well, we're so grateful for all of the care that nurses like Ms. Straube are providing, and of course the care that doctors like Dr. Jarrett are providing. That care is so essential to the patients and to the families who cannot be in that room. The situation for our care providers and our local hospitals is extremely concerning right now. In less than 3 weeks, Lincoln hospitals have seen the number of patients hospitalized with COVID-19 nearly triple, from 51 COVID positive patients on October 26th to 142 patients as of midnight last night. And joining us again today with an update from our hospitals are Derek Vance, who is the president of CHI Health St. Elizabeth, and Russ Gronwald, the president and CEO of Bryan Health. Derek, over to you.
Thank you, Mayor. Good afternoon. So in the last week, the total number of COVID positive patients in our health system has increased by 25%. The number of COVID patients in our intensive care units has increased by 50%, and the number of COVID patients on ventilators has doubled, all since last Friday. Our emergency room volumes are rising rapidly along with pediatric visits, which is typical for this time of year, but that adds additional strain to our already busy hospitals. Holding patients in the ER for several hours while waiting for bed placement is something that we have always tried to avoid. This is now unavoidable. Our intensive care and general medical beds are stretched beyond their normal capacities. Our nurses are working especially long hours, extra shifts, to ensure that proper and excellent care is provided to every patient. In our hospitals, all staff now are being asked to step up and work additional hours and jobs to support the steep demand curve for patient care here in Lincoln. We continue to have a strong supply of both ventilators and personal protective equipment such as masks, gowns, and gloves. Those are not our current issue. Staffing our beds, as I mentioned last week, continues to be our main issue. And if the current trend for hospitalizations and critical care beds continue, I'm concerned that we will have demand that exceeds our supply within a couple of weeks. So this week we've tightened up on elective surgeries more than what we announced last week. We're now postponing all elective cases that require a hospital bed and that can be delayed for 4 weeks or more. Previously, we were waiting on surgeries that could be delayed 12 weeks or more. That has now been dropped to 4 weeks or more. This move to postpone non-urgent cases does not lessen our commitment to care. The situation is serious and our hospitals are in crisis and are being stretched further every day, but we will not be considered full until every operating room, recovery room, hallway, patient bed is in use. As I mentioned last week, CHI Health has set up a statewide transfer center as a support to all Nebraska hospitals. We've done this to open up beds and to assure that no single hospital becomes overwhelmed. We are in this together, and Nebraska hospitals are working more closely together than ever before. But that alone will not be enough. The most important, most critical work rests with you. Washing your hands and limiting gatherings work. Social distancing works. We know masks work. With Thanksgiving right around the corner, these simple acts will make a difference in controlling the spread of COVID-19 in our community. Please continue to mask. This is the most effective method to limit spread. We've been through an extremely tough year as a community and are all frustrated and are tired of the pandemic. But we simply have to do better. We have to slow the spread, or our hospitals and health systems will be taxed beyond their capacities. I want to reiterate how proud I am of our healthcare teams who selflessly come to work each and every day. They are dedicated and committed to you and to our community. Our doctors, nurses, pharmacists, our staff who clean the rooms, therapists, technicians, and so many others, our first responders, are true heroes. And they are all committed to seeing our community through this pandemic. But they are exhausted. They have been at this for 9 long months and they are tired. Please help them by wearing a mask, avoiding crowds, social distancing, and washing your hands. Thank you.
Good afternoon. I'm Russ Grunewald at Bryan Health. I would tell you that today I'm as both discouraged and hopeful as any time during the pandemic that I've been. I'm going to just talk about the discouragement first. We've doubled our COVID population at Bryan in the last 2 weeks. We've tripled it in just over 3 weeks, actually 23 days. At Bryan, our capacity is about 562 beds in Lincoln. Actually, really about 530, but we've stretched it to 562. And during the first 12 days of the month, we were over that 530 more than half of the time. We're over 560 on several occasions now over these last weeks. Whatever you've heard about the capabilities and the supply of beds, I want you to hear this. There are no more beds. There are no more beds at Bryan if we keep doing what we're doing. And I'm on the calls with hospitals across the state. Every hospital across the state can be on that call. And I'm hearing the exact same thing that I've said and that Derek has said today. There are no more beds or there are no more staff to take care of folks. Derek talked about the transfer center. The notes that come back from the transfer center is that most of these patients are taking up to 8 calls to find a bed in some available hospital. There are no more beds or there are no more staff. Earlier today, the governor outlined a percentage gradation where certain restrictions kicked in. At Bryan, we were this morning, at midnight, we were at 23% COVID patients. At 7 a.m., just 7 hours later, we were at 25%. We're already into the next gradation from what was outlined earlier. So what are we doing? We previously have announced that we would not be doing elective surgeries that require an overnight stay, and we're seeing a little bit of temporary relief from that. However, the projections look like nothing is cresting yet, and so we expect that relief to be only temporary. So this morning we announced that we would do only urgent and emergent surgeries that require an overnight bed. Right now it doesn't affect the outpatient stays that don't require a bed, but anything that requires an overnight bed, we're doing only urgent and emergent surgeries starting Monday, and we'll be canceling many of the others. Practically what that means is we're going to be canceling many hysterectomies, most hernia repairs, and even some heart valve replacements. Those will be delayed. And many others as well. Those are just examples. Other things that we're trying to do to make sure that we have enough beds open for you. We're retraining staff. We've opened 40 new beds. We're repurposing countless other beds. Next week, we're taking out of service procedural areas to free up another 8 rooms. And all that will be left are pre-op and post-op rooms from surgeries. Those aren't meant for this kind of care, but that's all that will be left after next week. In summary, we're finding a way to accommodate COVID needs by compromising on the necessary needs of others. And if that sounds alarming to you, you are getting the right message. It's the one that our medical staff has asked us to relay to you. This is a critical time. I'm going to encourage people who are sponsoring events out there. I want to go to those events. I would like to get some relief during this time. But every time you do that and people come and do not mask, it delays our ability to get out of this situation and back to normal. Like Derek said before, if you need care and you end up at Bryan, here's what I guarantee. You will be treated by outstanding, well-trained staff. You will receive outstanding, safe care. But we need things to change. Now, I'm also hopeful, and I mentioned that. We heard messages this week about a new vaccine from Pfizer that's very close, and that also means possibly another vaccine from Moderna might be well on its way because it's similar to that. We've also heard about Eli Lilly's monoclonal, I can't even say it, antibodies.
Go ahead and why don't you just ask pharmacy for a perception?
Yep. But the amounts that we're scheduled to get from the antibodies and from the vaccines at this time are not enough to cover very many folks. Dr. Fauci said that we should be ready for those in April, May, or June. So help is on its way, but we need you to get us through these next months. We need you to follow the guidance so we can take care of our neighbors. whether it's because they have COVID or because they have another healthcare issue. We want to be there for you, but that's up to you. Thank you.
Thank you, Derek. Thank you, Russ, for your leadership throughout this pandemic. Thank you to your team for the heroic efforts they are performing to keep our community safe and healthy, to provide healing. We now have Dr. Jarrett with us, and we'd love to hear from him about his experiences on the ground in the hospital as a pulmonologist. Over to you, Dr. Jarrett, and thank you for joining us today.
Thank you. I'm sorry I couldn't be there in person. That is almost poetic in that, we were tending to a patient with COVID-19 who needed to be urgently intubated. And so, everything that everyone has said, just echo all of that. From a personal providing care day to day, it has been a grind. And just to kind of back up and introduce our group. So I'm one of 14 pulmonary critical care docs here in Lincoln. We are the only group in town. There's only 14 pulmonologists in Lincoln itself. We have 8 to 9 mid-levels that also are in our group. We have offices in Lincoln and Omaha. We provide telehealth care to many of the surrounding communities. So places like Columbus, Beatrice, North Platte, we reach out and help them. So, everything that you see on social media, every story that you hear on Instagram, Snapchat, you can take that situation of some catastrophe, some tragedy, some story of a family not being able to be with their patient, not being able to hold their hand while they're dying. That is happening here in Lincoln. I'm happy to know that we're finding beds in places, but one of my concerns is that we can't find nurses. We can't find more respiratory therapists. We can't find more pulmonary docs. So it's good that we have the beds, but the manpower, we are all feeling it in the hospital every single day. It's been, looking back to how busy we have become in the last month, I don't ever recall being this busy in the hospital here in Lincoln. I've been in town practicing for 10 years, and it's been something that I never could imagine would happen. You hear people say, oh, it's just the flu and this and that. This is nothing like the flu. People will get sick with COVID. And of course, there's the patients that do not show many symptoms right away. They may go through the illness and they don't know if they even have it or not. There's the patients that will have the mild flu-like illness. They don't end up in the hospital. There's the patients that then become short of breath, needing oxygen. That's where the hospital then comes into play. So the ER docs, the hospitalists admit them. We don't get consulted until they're on high levels of oxygen, needing different oxygen delivery devices. So we have, as a pulmonary group here in town, we have a little bit of isolation because we have such great staff and many different colleagues that help bear the brunt. But now you're seeing where the advanced respiratory failure patients that need the BiPAP, need the heated high flow, need the ventilator are starting to tax our group. We are having to put extra people on call for the weekends. We're saying if we can't cover the census, we need to pull the docs out of our outpatient clinic, move them into the hospital. That's going to impact people that are going in for your routine asthma, COPD, whatever your chronic lung disease is. You may have to wait because those patients, those appointments won't be available. Just, immediately today, we had the last ventilator or the last ICU room get full. So we're having to get creative to shuttle devices, find new rooms, here in this hospital I'm at. So it is real. It is impacting us. It is taking an emotional toll on all of us. We would have, going back to the analogy of it, this is more than the flu. We can all recall times where we've had viral pneumonia where somebody ends up with respiratory failure on a ventilator, and you're having end-of-life conversations with patients' families in the room. They can see the patient. They know what they're going through. Here, you're having multiple of those end-of-life conversations daily, but the patient's families may or may not be able to be there. They're having to see their loved ones over FaceTime or Zoom or whatever technology there is. And that creates a whole new level of stress for not only us as physicians, or is the family getting the right information? Are they fully understanding and comprehending what we're trying to tell them? They're not there physically with the patients. That the nurses are bearing the brunt of that, because we may be the only contact of that patient for 2 to 3 weeks. So emotionally, that takes a toll on all of us. And it's, as dire as this all sounds, what I don't understand is that this can be preventable. Wearing a mask, washing your hands. It sounds redundant, and it sounds like if you say it enough, you lose the impact, but it is the only thing that will cut this down, and it will take care of it. If you stay out of indoor gatherings, we haven't been in a restaurant since March. We haven't been in church except for when our son was confirmed. It's not fun. We don't want to be like that, but it's what we have to do. So it is preventable. And I didn't think I'd get emotional, but we need help. I had a lot more to say, but I'll let you carry on. Thank you.
Thank you, Dr. Jarrett. Thank you so much. Thank you for sharing your experience and for all the care you're providing and that your team is providing. As a community, I hope you're hearing the message from these heroes. We have the power to support these healthcare heroes. The choices that each of us make today directly influence the ability of the virus to spread, and therefore determine the number of cases and hospitalizations we will see in the coming days and weeks. The actions we take today to slow the spread of this virus, change our situation, and protect ourselves, our loved ones, and our healthcare system, those choices matter. The next few weeks are critical. And before I turn this over to Director Lopez, on behalf of our entire city, I want to offer condolences to the friends and families of the 7 Lincoln and Lancaster County residents whom we have lost this week. I sure would like to have a moment where I don't have to offer condolences during one of these briefings. And like Dr. Sherritt said, you can help do that by taking precautions that require very little sacrifice, but are sacred in nature to the people being most affected. Director Lopez, over to you.
Thank you, Mayor. We continue to see a rapid increase in new cases. Today, another 161 community members have tested positive for the virus, bringing our total to 12,284. In just 3 weeks, our number of weekly cases has nearly doubled, from 645 the week ending October 17th to 1,246 cases this past week. So far this week, we have 1,336 new cases. That's a new weekly high, and we still have one more day in this week. This is also the second consecutive week with over 1,200 cases reported. The 7-day rolling average of new cases shows that we have more than doubled the average in just 3 weeks, from less than 100 on October 26th to 238 on November 11th. Our positivity rate also continues to set new highs. And it's not because of more testing. While our number of tests per week have stayed consistent, our positivity rate nearly doubled in just 2 weeks, from 13.3% the week ending October 24th to 25% the week ending November 7th. This high rate tells us that the virus is widespread throughout Lancaster County. As our hospital administrator stated, we are very concerned that the spike in new cases will increase hospitalizations in the next few weeks. On this chart, the orange line represents the 7-day rolling average for new cases. The purple line represents the 7-day rolling average of hospitalizations. And you can see the corresponding increase in hospitalizations a few weeks after the increase in our cases. An additional concern is the age of the individuals now testing positive. For the week ending November 7th, 210 of the new cases were individuals age 60 and older. This week, we are on pace to have about 200 more new cases in the 60 and over age group. That is more than 400 new cases in individuals that experience shows us are at higher risk of needing hospital care. I cannot stress this enough. We must take action now, before the hospitals are overflowing. The actions we take today will impact our situation 2 weeks from now. Thank you to the majority of our residents who are doing the right thing, consistently wearing a mask, staying at least 6 feet from others, and limiting time with those outside of our households. But too many people are not taking the simple steps that are effective in preventing the spread of this virus. And one infected person can cause many others to become sick. To put this in perspective, the Georgia Institute of Technology, along with researchers at the Applied Bioinformatics Laboratory and Stanford University, developed a risk assessment tool based on the level of virus in every county in the U.S. If you gather in a group of 10 people in Lancaster County, there is a 25% chance that one person has the virus. In a gathering of 25 people, the chance that one person has the virus is 50%. In gathering of 100 people here in Lancaster County, the chance that one person is infectious is over 95%. That's why gatherings continue to be one of the focus areas in our directed health measures, and we continue to adjust those directed health measures to respond to our current conditions, to protect the health and safety of our people, to keep our businesses and schools open, and to prevent our hospitals from becoming overburdened. We are implementing the following new measures that will take place on Monday, November 17th. Indoor gatherings will now be limited to no more than 10 people or 25% of capacity, which is in sync with the state's directed health measure. All events and venues with a capacity of 500 or more must be postponed until December 7th. Venues with a capacity of 500 or more people that are planning events after December 7th must have an event plan, regardless of how many people plan to attend. Previously, those venues only had to submit plans if attendance was expected to be more than 500. Our case investigations show that crowds at our local bars tend to increase after 11 p.m. Starting Monday, all businesses that sell alcohol must end alcohol sales no later than 10 p.m. and must close no later than 11 p.m. All indoor team sports for youth are postponed until after December 7th. Individuals must wear masks indoor unless no one else is in the same room and they can maintain at least 6 feet of separation from others at all times. Companies licensed to allow consumption of alcohol on city streets, such as pedal pubs and party buses, may not operate until after December 7th. This directed health measure will remain in effect until December 7th, and we will continue to make adjustments as needed. We need your help now. We need to help our community. Thank you.
Thank you, Director Lopez. She's right. We need our community's help. And my job as your mayor is to tell you the truth. So I'm going to be honest. I'm really concerned about where we are right now, where we're headed if we don't get this virus under control in our community. The situation in our community is critical. People who provide medical care are incredibly stressed by the increasing number of people they must care for as cases rise. Not to mention those physical demands of PPE that they have to wear and the toll of standing in for family members and providing emotional support for their isolated patients, as Dr. Jarrett spoke to. As you've heard today, we are seeing people sit in the ER waiting for beds to free up so they can be admitted to the hospital. I've heard that staffing shortages are making it difficult to open up a specialized COVID unit. I've heard that the ability of our nurses to provide the best practice of a one-to-one standard of care to patients in the ICU is threatened. I've heard that doctors are nervous about where we are going. I've heard from a mother who is afraid for her daughter's health and welfare as her daughter works 12 hours a day as a physician assistant providing pulmonary care in the hospital. I've heard that more and more of our nurses and other care providers are having to quarantine and therefore are unable to report to work in our hospitals. Finally, it's important to note that we must protect our first responders from exposure to this virus so that they can stay safe and are able to respond to those 911 calls that we make. Remember, our community's workers who perform essential functions, our first responders, utility workers, our healthcare professionals, they're not immune to this virus. And when we see the risk of COVID-19 spread increase in our community, that means that the risk that these workers who perform these essential services, their risk of getting sick goes up too. We don't want Lincoln and Lancaster counties paramedics, our water treatment plant professionals, our police officers, and our healthcare workers in quarantine. This severe level of risk in our community has the potential to impact many of the services on which we rely for our health and safety. This all adds up to a very serious situation. I'm part of this community, and I'm really worried. I'm worried about my kids and my family, and I'm worried about yours. I know someone who recently died from COVID-19. I'm really worried about everybody, because even if you've already had COVID, I'm worried that if something else happens to you, if you have a heart attack or a fall, I'm worried that soon our hospitals will be too overburdened and understaffed to provide the normal standard of care for you. I'm worried when I look at what's happening in our neighboring states of North and South Dakota, where they're having one of the worst outbreaks in the entire country. With hospitals at capacity, North Dakota's governor is letting healthcare workers stay at work even if they test positive for coronavirus. I'm worried when I look at what's happening in Montana, where hospitals are becoming so overrun that they're having to send some critically ill patients out of state for care. And I'm worried when I see pictures on TV of the mobile morgues being set up in El Paso, Texas, because the medical examiner's office there is full with bodies. I don't ever want to see images like that here in Lincoln or in Nebraska. So I'm being honest about the concerns I have when we look at our numbers today and when we talk to people on the front lines of our local COVID-19 response. And I'm sharing these concerns with you because it's only by understanding the facts of our situation that we can take the necessary actions to protect ourselves. Lives and livelihoods in Lincoln and Lancaster County are at risk. Our friends, our family, our neighbors, our first responders, our medical care providers, our businesses, they're all at serious risk. The good news is we have the power to reduce our risk. We do not need to be scared. We just need to be strong. So this is what we're going to do together. We are going to take some hard steps to turn this around. And in addition to those hard steps, those new directed health measures that Director Lopez outlined, we need to be clear that now is the time, not tomorrow, not next week. Now is the time to limit contact with those outside of our households. It is in our nature to want to be together, and especially during the holiday season. But now is the time to show our love and care for one another by not getting together. And to this end, all large indoor and outdoor public gatherings, as well as large family gatherings, are highly discouraged at this time. Employers are encouraged to let employees work from home if possible. This is the time to return to virtual religious services, to takeout or no contact deliveries and curbside services. And older adults, those with underlying health conditions and other at-risk populations must be especially careful. Please stay home, rely on help from family or friends for needs outside the home, and distance yourself from household members who work outside of the home. As we have done throughout this pandemic, we've been in regular discussions with the people and businesses in our community, including our bars and restaurants, our event venues, and schools who have been so significantly impacted. We know that it is an understatement to say that today's announcements are disappointing to our community's student athletes and difficult to bear for our affected businesses. Our hearts are heavy too, and we feel enormous gratitude for their sacrifice and for the strength and resilience they are demonstrating during this pandemic. Here to share more insights and perspectives on why these steps are so important are Dr. Steve Joel, Superintendent of Lincoln Public Schools, and Dr. John Schwartz, the Superintendent of the Norris School District. And after they speak, we are pleased to have Scott Hatfield here from Duffy's Tavern. He's going to say a few words from his perspective as a bar owner downtown. Dr. Joel, over to you.
Thank you, Mayor. Thank you, Director Lopez. Mayor, I just want you to know that we all share in your worry what this virus represents and our inability to be effective in mitigating its risk. We're 13 weeks into the school year. It's been one of the most challenging school years in the history of Lincoln Public Schools, and I would submit of all of education across the country. One look at our dashboard shows that, like the city, we're seeing increasing numbers of students and staff in isolation as well as in quarantine. But we understand that we have to make tough decisions, and we support the latest directed health measure regarding a delay in youth sports for a period of 3 weeks to determine if this will help the community address its growing virus case numbers. I'd like to apologize to all of our student athletes who have been working hard and looking forward to this time, but we're hopeful that we can resume at some point in the near future if we can get a handle on virus incidents. But since it has been identified as a way of slowing the spread, our delay of youth sports will be a part of the solution for the entire community. With 42,000 students and 8,000 staff, we are a significant part of Lincoln, and as such, this is one way we can contribute to the spread. As they did in the fall and early summer, student athletes will be able to take part in workouts and team meetings remotely, but they cannot gather either with their coach or on their own. What we do now protects the rest of the winter activity season. Practices and events will continue as scheduled through the weekend. Events and competitions scheduled during the moratorium period that runs from November 16th to December 7th may be rescheduled or canceled. More details about remote practices and future schedules will be shared directly from the schools when the information is available. This is just one way we can do our part to help fight the spread. We have heard from a number of concerned parents, staff, and community members. We share your concerns. Students need to be in school, and we will do our part to do what we can to help the community move forward and flatten the curve so that we can indeed continue having school. Our staff have been working at a feverish pace to keep up with the needs of our students, our families, and our community. They're dedicated to making this work, just like many in our community, and in particular our healthcare workers. Everybody is putting in extra time and effort where it's needed, giving more than 110%. Teachers are giving up their scheduled planning time during the school day to help cover each other's classes because of isolation and quarantine, to make sure our students get what they need, that they are taken care of. Administrators are covering classes. Custodial teams are doing extra cleaning. Staff are taking on duties beyond what they are normally tasked to do, and everybody is pitching in. And for that, we're grateful. And I know our community is thankful for all these efforts to keep our students in school. But this continuous, rigorous pace is starting to take a toll on our staff, and that in turn affects our students. Our students, too, are feeling the pressures and added stress of this year. That's why today, together with the Board of Education, we are announcing a change to our student calendar to support additional time for our staff to catch up and recoup lost plan time. There will be no classes for students on Monday and Tuesday before Thanksgiving, November 23rd and 24th. Students will not have classes during those 2 days before Thanksgiving break. This will allow staff to pause and do what they need to do so they can continue to provide what our students need, and we can finish the fall semester strong. Community learning centers will be organized to offer services on those days. Families can check with the CLC leaders at their buildings for details. Our teachers will have the flexibility to work from home. All other LPS staff will report as assigned by their supervisor. Middle and high school will return to classes on Monday, November 30th. Elementary students return on December 1st, since Monday the 30th is an elementary plan day. We know our students and staff will continue working hard over the remaining 3 weeks to follow the safety protocols at school and our community so we can finish the semester strong going into winter break. And I want to just add to what the mayor said. We believe that this time is necessary for our staff to gather themselves and take a badly needed break. But we also know that our students and our families need to do what the mayor has suggested. If we want to continue to have school, we have to limit the spread. And it's going to take every one of us that week of Thanksgiving, the interim between Thanksgiving and Christmas and into the new year, to do as the mayor suggested, and that is limit our involvement with others outside of our household and practice the safety protocols 24/7. I'd once again ask all of our students and all of our staff and all of our families to please be the role models within the city so that we can continue to do what's been our goal since the beginning of this pandemic, and that is to continue having school. Thank you, Mayor, and I know that Dr. Schwartz from Norris Schools is up next.
Thank you, Mayor. Thank you, Director Lopez, and to your staff as well, and all of our medical professionals that are here today and serving in our hospitals right now. I'm not really sure what else needs to be said to communicate that this is a very critical moment right now. For our community, for our hospitals, our healthcare providers, our students, our parents, and all those that we love and care about. It's really been a dueling narrative for our schools this year. On one hand, it's been an incredibly proud moment. Our students have been resilient. They have done what it is that we've asked them to do. They've risen to the occasion. We've seen tremendous leadership and sacrifice, and they have been doing what they need to do to stay in school and to be safe and to keep their teachers safe and to allow us to do what we're doing. We've seen our staff work incredibly hard and show dedication and commitment like never seen before. Dr. Joel mentioned that this has been an incredibly challenging school year. I think that's an understatement. Our staff have given everything to keep our students safe. They're incredibly conscientious. They want to be safe themselves. They want their students safe. They want students to be in school. But they also want to make sure they're providing engaging instruction for our students. And the fact that they're able to do all that to the extent that they are, in my opinion, makes them heroes as well. And we're thankful for that. It's also, on the other end of the equation, it's an incredibly challenging moment. And that's the other narrative that's playing out right now. And I thought Dr. Joel highlighted that very well. Our staff, the demands and the expectations that they have of themselves and we have of them in order to create a safe environment of our classroom is significant. Yet they're doing it. The demands of serving students in multiple modalities is a challenge, and yet they're doing it. Our students, again, they continue to be resilient, but there are opportunities that they do not have this year that they would in a typical year, and that's a challenge. And beyond that, there's the raw logistics of it. As the prevalence of the virus has increased within our community, we've seen more students and staff getting exposed and having to quarantine. Those quarantines have led to disruptions in many places where staff have had to cover for other staff during planning periods, and our school administrators work diligently each day to find coverage for those individuals. And we continue to solve those problems and do the best that we can, but we need your help because our margins in many of those staffing areas, our secretaries, paras, teachers, administrators, are not that significant. And as the prevalence of the virus continues to increase, it exposes more of them outside of school, and it increases the probability that we'll have disruption in services within our schools. We've also seen more students getting exposed outside of school as well, and that has led to them being quarantined also, and sometimes also contracting COVID-19, and that's taken them away from being able to come to school each day. And our students want to be in school. So like everyone else that spoke before me, please heed the advice of our public health leaders. Do it for your schools, do it for your medical providers, for all the loved ones that you have and the loved ones for our friends and neighbors that we want to make sure have high quality health care and services in the event that they get sick with COVID-19 or any other ailment that requires medical attention. It is the right thing to do. It's necessary. It's time. We really appreciate the leadership of you, Director Lopez, and your staff. And thank you.
Greetings, I'm Scott Hatfield from Duffy's Tavern at 14th and O Street. First, I want to thank the mayor. This is an especially difficult time to be a public official, and trying to weigh the balance between saving businesses and saving lives is certainly not easy, and her courage is surely appreciated. Just a little background real quick. Duffy's Tavern has been around at 14th and O since the mid-1930s. We've hosted live music since 1986, and we typically host live original music 4 nights a week. Since the beginning of the pandemic, of course, we've had to cancel numerous acts, and I think a lot of people in my industry are feeling similar pressures. And I think I can speak for most of us when I say that we're just really trying to survive until springtime. Most of us in the bar and restaurant world, not all of us, as you've probably seen on social media, but most of us have worked very, very hard to follow the directed health measures. It's not an easy line to toe, telling people to sit down, telling people to take their seats, to wear a mask, not to congregate with other people, to stay in groups of 8. That's really a hard thing to do. It's especially hard in the bar world, but it's something that we all are capable of doing, and it's something that we've been doing for quite a while, and I think we can continue to do it. Most of the people in my industry are extremely stressed. They're broke. They're tired. It's a very, very difficult world. Nothing about 2020 is normal. But of course, what we really want to do is we want to get back to normal. And I think the way for us to look at this is what's going to get us back to normal most quickly. And as much as these new directed health measures might seem difficult, as much as they might seem like it's another layer for the already uncertain future for bars and restaurants, without question, this is the right thing to do. And as hard as it may be on those of us in my industry, and as hard as it may be on those of us in the city of Lincoln, this is a time to change, and this is a time to take these things seriously. We want to get back to normal life, and I think the fastest way for us to do this is to stop taking half measures and to take real action. The experts are telling us that limiting large gatherings is a critical step. And I think more than ever, now's probably a really good time to start listening to the experts. This isn't about politics. This is about protecting human life, and it's about common decency. We only get one chance to do this, and we only get one chance to do it right. And I hope that me standing up here, and this is an extraordinarily difficult year. It's an incredibly difficult year, financially, personally, on so many levels. But we're willing to do this, and we're willing to shut our places down because we don't want people in Lincoln to continue to get sick. We're really looking forward to a return of normalcy in 2021. There is optimism on the horizon. There's a vaccine that shows promise, and there's all kinds of good things. Concerts will be back. The neighborhoods will again feel vibrant. People will be downtown. 14th and O will again be a busy neighborhood, and a neighborhood full of fun and vibrancy and all kinds of things to do. But until then, we've got to support each other, and we've got to take care of each other. And I appreciate the mayor's leadership on this, and we look forward to hopefully seeing these cases in Lincoln start to take a decline. Thank you.
Thank you, Scott. Thank you, Dr. Schwartz. Thank you, Dr. Joel. Thank you to everyone who's been a part of this briefing so far. Your leadership, your courage, your selflessness, your generosity, and your care and compassion for the members of our community is profound. And I hope everyone can feel it. I feel it. To everyone else, we want to be clear that we're going to give these new measures, at least 3 weeks to see if they can turn things around and reduce the spread of COVID-19 and protect our people, our businesses, our schools, and our healthcare system. We know, though, that hospitalizations typically lag several weeks behind cases, and doctors say they're seeing more severely ill patients during this recent surge. So we expect that the actions we take today will take several weeks to have a significant impact. If after 3 weeks our cases continue to rise and our hospitals are full, we will need to take further, stronger measures. You can help us avoid that by doing your part. Just like Dr. Jarrett said, this is preventable. Our healthcare providers, our first responders, our businesses, schools, and our children need all of us to do our part. Everyone in Lincoln and Lancaster County can be a leader in this fight. Everyone has a critical role to play in rolling back the risk of COVID-19 spread. We know we can do this. We did it in August when we started to see a surge in cases. Our city masked up, and we didn't just flatten the curve, we bent it back down. I've talked to local, regional, and national public health experts who say our mask mandate saved lives. You have saved lives. Today, I call on everyone in Lincoln once again to help save lives, to help keep schools and businesses open, and to help prevent the collapse of our healthcare system. The ways we do that are straightforward and simple. They involve short-term sacrifice, but they ultimately give us more freedom by allowing our businesses and community to remain open. If you want our businesses and our community to remain open, please minimize contact with others wherever possible and limit activities outside the home unless for work, school, medical care, or food, or to care for someone else needing assistance. Help prevent illness and needless suffering, your friends, your neighbors, or your own, by practicing the 3 W's. Wear a mask, wash your hands, and watch your distance. For the next 3 weeks, please avoid all gatherings with anyone outside your home. And if you must go out for essential errands or items, only visit businesses that follow public health guidance. These steps won't be our new normal forever, but this is the now normal. Getting this virus under control is the key to our community's renewal and recovery and to brighter days ahead. Thank you for paying attention and thank you for caring. And with that, we'll open it up for questions from the media.
We have a question from Jeff Robb and Andrew Ozaki. Can you define the scope of what youth sports are affected? Does this affect at all college sports? Is this, can you just explain the scope?
Sure, I can explain that. We're talking about youth sports, K through 12, and we're using the guidance from the Department of Health and Human Services here, put out on June 19th, 2020. This includes a full list of contact, limited contact, and non-contact sports. And we're talking about youth sports, K through 12. And it includes club sports, all of those activities. It's not just pertaining to schools, just to be clear.
And Pat, Andrew Ozaki also wanted to know if most of the community spread is coming through informal gatherings. How will limiting bars and sporting events help out?
Well, I think we know that the community spread, we see that in smaller groups, but we also know larger groups. And what we're encouraging people to do is stay home as much as possible. In limiting sports and decreasing the times when our bars and restaurants are open will have an impact. We know that from all of our research and what's happened nationally. So that's why we're taking these strong measures right now. We want to keep our schools open, as many of our businesses still open and operating, even if some are at a reduced level.
Pat, Riley Johnson from the Journal-Star.
Hi, Riley.
Hi. Is the health department recommending families cancel Thanksgiving and other holiday plans out with people outside of their household?
Yes, we are, Riley, and we'll be putting out a press release early next week and talking more about that and providing guidance. As hard as that is, it's really hard for me to even say that, but I do know we need to do that this time. And hopefully if we can really crunch this down, we'll be looking at a different future later in December.
There are other questions from the media?
Oh, Riley with the Journal Star. I had a follow-up question for either Mayor or Health Director. Has the city taken any further action with respect to the Royal Grove and their DHM violations that were being looked into by the city?
We have requested the Royal Grove submit a revised event plan to us. And Johansi Christie, our city attorney, is here and he can address your other questions, Riley.
Hi, Riley. We are currently considering legal action at this time. I think the information came, I think it was Tuesday, and investigation is underway. We will certainly we'll let you know as soon as it happens, and it should, if it happens, and we expect a decision early next week.
Thank you.
Any further questions? All right, well, I just want to say again, special thanks to all of our guest speakers and community leaders and healthcare heroes and educator heroes who are here, and our business owners, everyone who is doing their part and leading the way. Thank you all for joining us for this briefing, and thank you to the public for listening. Thank you for joining forces with all of us who are wearing masks and washing our hands and watching our distance to protect our friends and our family and our neighbors from COVID-19. Together, we are greater than this virus. Thank you.